Welcome back to the Daily Drum on WHUR and Sirius XM Channel 141. This is the Insight segment. I'm Harold Fisher. Last week, the Prince George's County Public School System announced that it lost 2 elementary school students to the flu. This tragedy is the focus of our Medical Monday conversation as we sit down with Superintendent of the Prince George's County Public Schools and the County Health Director. The school system is battling a serious uptick in flu cases, and an investigation into a third child's death is underway. We have a lot of questions, including what is the call to action for parents, students, educators, and the wider community. We begin tonight with Prince George's County Public Schools Superintendent Millard House II. Mr. Superintendent, thank you so much for joining this conversation.
Harold, thank you for having me, and we appreciate the opportunity to be here to share with our community.
Thank you so much. Let us first talk about any late developments. When we spoke on Friday, as I said, there was a health department investigation into the death of a third child from Whitehall Elementary School. It was not known on Friday whether or not the passing of that child was attributable to the flu. Do you have an update on that?
We don't have an update on that. Generally, that is information that comes to the parents first, and the parents have a choice to share that information or not. The health department would probably know that information before the school district would know. So we might have an update from the health department director when they come on.
Very well. The school system, as you mentioned again last week, began notifying parents officially today. You mentioned robocalls and the like. What was the process, either over the weekend or even today?
The process starts with taking a close look at data. And what I mean by data, enrollment data. If we generally see a 9 to 10% absenteeism data point, it lets us know something's going on. But the most prevalent data point that gives us insight is when parents let us know that, hey, my child is out and my child has the flu. So we did have that to happen in a couple of schools. Ironically, they were not the schools that we had deaths in. James Madison is one of those schools where we did have high absenteeism. And when we found out more information, a number of those students that were absent due to the flu. They had 70 plus cases. And in that scenario, we immediately communicate with our health department partners to determine, what measures need to be in place. They have the ability to really take a close look and see, and they did give some recommendations. One of those recommendations had to do with masking for 2 weeks. So we've had a couple of schools, but ironically, as I indicated, neither of the schools, one was a charter school, CMIT, where we had a death, and but neither of those schools have had major quote unquote outbreaks.
Interesting. What did parents hear? Were those robocalls sent out today?
So parents have heard a couple different things. Essentially, what we have shared with media, we've been on with you. You were actually the first to kind of been provided with the information to break this story. But we've been on with ABC, CBS, Fox to really share, what we're doing as a school district, which is enhance, of course, cleaning at our schools, much like what we did in COVID, increasing disinfectants that are being utilized, those high touch doorknobs, buses, a little bit of everything, hand sanitizer being provided to these schools, temporary masking in certain situations as well, on-site flu vaccinations as well. We are partnering, as I indicated, with the health department. So where we have high concentrations, we target those particular families to say, hey, here's the availability to be vaccinated. Here's when it's going to happen. As a matter of fact, we have one this coming Wednesday, which is the first targeted vaccination opportunity. We also send out information around extracurricular adjustments and ongoing monitoring. The data is what's important. And our Prince George's County Health Department is very, very important in reference to this data piece. One of the things that's kind of caught me off guard is really just this season as a whole. Harold, we've seen about 60 pediatric deaths across the country. And of those 60 pediatric deaths, of course, I don't think that even accounts for the ones that we had. We had 60 as of last month, if I'm not mistaken. But get this, as we think about, the data as a whole, there have been about a little over 300,000 hospitalizations due to the flu. 24 million folks that have caught the flu, 13,000 deaths this season. And probably more importantly, as we look at vaccination rates in terms of the flu, we've had about 44.5% of kids that have been vaccinated across the U.S. specifically. And that's down from the almost 50% a year ago. So that in itself tells us that we're seeing less students be vaccinated. And I don't know if that's due to, vaccination fatigue with COVID, but that's a tick in the wrong direction. And it's unfortunately a portion of why we're seeing what we're seeing.
Yeah, it's interesting you should mention that because, and certainly I'll ask the health director when he comes on, but usually when we have conversations, when I say we, I'm talking about the public and health professionals. They start talking about preparing for flu season in late summer, early fall. That's when the vaccines are available, the new batch. That's when they're available. This is March. We are in the beginnings of spring. And so I think a lot of people, they're kind of surprised that this kind of thing is happening so late.
Well, I think a part of that is because it's been a bad season. And nobody can predict how bad the season is going to be. This has been a bad one nationwide. But in terms of us promoting, it's been no different than any other year. We've always influenced individuals. We can't require, but we can make them available, both for employees as well as, in some instances, students as well. But the health department, it's the same thing because a majority of those individuals will come through the health department to receive those vaccinations. So, nobody predicted the year that we've had. Nobody predicted that there would be less individuals in terms of vaccinations that would be in place either. So it's definitely unfortunate set of circumstances overall nationwide.
You spoke about targeted vaccination processes on Wednesday. Break that down for me. What is going to happen on Wednesday?
That's essentially, you mentioned the robocalls. We're sending information home, whether it be social media, robocalls, letters, however we can get in touch with parents to let them know that, hey, in your particular community, the health department has identified that there are a number of flu cases in this particular community. And we want to offer anyone who wants the opportunity to come in to a vaccination clinic in your community to provide vaccines free of charge. So that's happening. The first is Wednesday, and we're excited to be able to partner with the health department to offer this opportunity.
Well, as it relates to the outbreak, and certainly I'm no physician, but with that said, the deaths happened at different elementary schools. The large number of cases happened at James Madison, CMIT, I believe it's in Laurel. James Madison is in Upper Marlboro. Those are at different parts of the county. So this is not concentrated.
Yeah. So, and that's the interesting thing and I think the health director can provide, more information around it not being concentrated to a particular area. But it finds itself where it finds itself. And I think it's up to us to be able to provide support in conjunction with the health department where we can.
When you talk about communicating with, parents, and I will say, look, after speaking with you on Friday, the first person I did call was my daughter. She is a Prince George's County public school, educator who does have other health challenges that could be impacted. And so, have you had a chance to speak with the teachers union or teachers in general? What are they telling you if you have?
One of the things that we've done, much like we've done in every other year, is offered all of our employees the opportunity to come in, and that happened way before this time, to be provided with flu shots. We actually did it on one site at Sasser, where I'm officed as well, but it was offered in other places as well. I think the health department is doing the same thing. I think what's different this year is that, much like previous years, we provide employees the opportunity to come in and receive flu shots. That's not something that is new to the district or new this year. It's something that happens on an annual basis, and we'll continue that. I think what's new is that vaccination rates are down and influenza is up. So I think people are feeling the tail end of it, especially when you talk about that nearly 65% of families that don't have students that are vaccinated. Now, some can't be vaccinated, and some have a belief system around vaccinations as well. Our job, quite frankly, is to inform and to be able to provide, and that's what we're definitely trying to do.
I want to ask you a little bit about history, your history. When the pandemic hit, you were not here. You were in Texas, and in speaking with the previous CEO of the Prince George's County School System and others, they learned quite a bit about infectious diseases, the spread of all of these things because of the COVID pandemic. And so I'm sure that you brought your own set of newly acquired knowledge, for lack of a better term, from Texas here. What, if any, information, knowledge that you gathered from the pandemic are you bringing as the Prince George's County School System tries to manage this issue?
I was a superintendent during the pandemic, and we all learned by fire during that particular time. One of the things that I learned is that we have to stay in partnership with our health officials. We can't, find ourselves in a position where we're not working with data and utilizing data. So that's, similar to what we're doing right now. And that's any infectious disease, quite frankly, whether it's COVID, whether it's influenza. You can have spikes in the right direction and spikes in the wrong direction. So that is the key in my eyes, is to have an open line of communication with the health department, so that when recommendations come down to move forward with certain strategies, that we can be prepared to do so. For example, when the health department came in and said, "Hey, we've reached that threshold of 10% in absences, and we're seeing a number of parents to share with us that a student has the flu." We in our warehouse have the mask in place, the cleaning materials in place, all the things that we need to do to ensure that we have that extra touch and those extra resources in hand to move forward. And we had those things in hand to move forward.
Interesting. I need to take a real brief break, but we want to continue this conversation on the other side. So please stay with us. And don't forget, you can hear this and every edition of the Daily Drum Insight segment via podcast on WHUR.com. The original Quiet Storm with Raheem Devon is next on WHUR. I'm Harold Fisher. We continue this Medical Monday conversation on Sirius XM channel 141 and 96.3 HD2 in just a few seconds. Welcome back to the Daily Drum on Sirius XM Channel 141. I'm Harold Fisher. We continue our Medical Monday conversation about the flu outbreak in the Prince George's County school system. We continue this conversation with School Superintendent Millard House II. One of the things that I also did want to ask you, and I want to drill down a little bit more just to kind of make sure that people understand how this works and get kind of an inside baseball thing. And I find it fascinating that when the health department comes to you and kind of rings the alarm and talks about absenteeism and what is the cause of it. And so I'm assuming this is a process that is already in place, that 10%. So it wasn't the passing or the loss of those children because of the few that was the thing that first alarmed you.
That's correct. The actual 2 deaths, and I want to take a moment, Harold, just to say that our hearts go out to those families in those 2 schools, their classmates, teachers, administrators, because they're reeling from the loss of a friend, the loss of a student, the loss of a son or daughter. So I want to say that. But in those 2 particular schools, those were 2 schools where we hadn't reached that 10% threshold. So they were kind of isolated scenarios. We had high rates at a couple of other schools. So they've been very isolated. Like you said, we're a large county, over 200 some odd square miles, and 208 schools. And of those 208 schools, we've seen 2 or 3 schools that have had high rates, outbreaks, however we want to articulate it. So a majority of our schools have not seen this scenario, but we have had to put some things in place in conjunction with the health department at a couple sites.
Have you spoken to those parents? And if not, do you plan on speaking to them?
We have not. I have not spoken with those parents, but our communities, we have a number of administrators, teachers that have been in touch, that know those families and that work with those families, that have been in touch to offer those condolences. I do look forward at the right time, because these families are grieving, and it's a very difficult scenario. So at the right time, I look forward to offering my condolences as well.
You mentioned when we spoke on Friday, when this story broke, you also mentioned dealing with sanitary conditions on the buses. Can you talk to me a little bit about that?
Sure. It's a simple part of the process. When we do have particular communities that we're moving forward with masking or additional cleaning, what we do is what's called enhanced cleaning, and that's increasing the disinfection of high touch areas, your doorknobs, your desk, at schools and on school buses. Additional sanitation supplies have been provided to schools. Hand sanitizer reinforcement as well, just ensuring that paper towels, soap and water, and hand sanitizing. Schools are posting reminders and reinforcing the best practices. I mentioned the temporary masking where necessary. I mentioned the on-site flu vaccinations, limiting exposure. And what I mean by limiting exposure, where possible, keeping students in consistent groups to limit interactions. And again, this is for those schools that have had high rates. And of the 208 schools, we've had a few where we've had to move forward with these kind of actions. Also, extracurricular adjustments as well. And that means modifying or postponing high contact activities at these 2 or 3 schools where we've had this activity. And then more importantly, as I indicated earlier, and as I'm sure the health department will share, ongoing data monitoring. We are working closely with the health department and officials to monitor flu trends and respond appropriately. We are tracking the different illness reports that are out there and provided with us by updating families regularly, and really urging sick students to stay home. And Harold, that's probably the most important piece, is if you have a child that is showing symptoms, we're sharing with our community. It's important to keep the child at home, get the child tested for the flu. The child could have something else, strep, flu. You just never really know. But that is one of the best ways to prevent spread.
What options are being provided to any students who may miss significant school time because of the illnesses of flu illness, to make sure that they are able to stay on track? Usually,
Yeah,
we're talking for 5 days. Obviously, it is well known that this is not a flash in a pan. This is affecting several schools, and certainly we would hate to see, but it could spread.
we have a makeup process policy that we allow students a certain amount of time to make up work. So that's really the least of the issues. We know if a student is out, homework or classwork is probably the last thing that they're going to be focused on. So once they're feeling better, teachers will work with those families to ensure that they have ample opportunity to make up work.
Why not, as a preventative measure, have these disinfectant cleaning protocols go school system wide, from elementary all the way up to high school? Because one would think, if it can happen in Laurel, if it can happen in Upper Marlboro, it can happen across the entire school system.
And it's and I probably didn't articulate that well. We are doing some of these things in all schools, much like during COVID. It was the season. We moved forward to provide those supplies, provide the processes for all schools during this particular time.
Okay. Yeah, because that was, and forgive me, because that was one thing that I did want to be clear about, because it would just seem to me, even if it's happening in a handful of schools, that absolutely, that one would think that it should be implemented as a preventative measure.
Absolutely.
I did want to go back to one of the other things that you were talking about the grieving families and some of the obvious struggles. How is your administration addressing any potential health effects, the grieving of students and
Great question.
and staff and the like? Because we are talking about elementary school students, the youngest students, and which is not to say that no age group will handle these things better, but elementary school could be what, kindergarten to sixth grade.
Absolutely.
And those are the ones who certainly, we know children are resilient, but this is, quite honestly, this is a terrible, terrible thing.
Absolutely. Unfortunately, Harold, there's the school systems across the country and PGCPS are not, we're in a situation where we have deaths throughout the school year, whether it be an employee, whether it be a student. Unfortunately, it's something that we see. So we have a process in place that really deals with support through counseling and mental health. So we have kind of a counseling impact team that we can place at a school, whereas students that may be struggling that show up to school can come into a particular area, whether it be the cafeteria, gymnasium, and talk to a mental health professional or a counselor. So in these sites where we have unfortunate deaths, whether it be COVID related, flu related, tragedy, car accident, we work together to provide those kinds of supports around mental health and counseling.
Do you have an idea of what that looks like? I mean, is it an assembly? Is it a parent needing to reach out to talk to a counselor? I'm not, even when I was a student in the Prince George's County school system eons ago, we never had the need, at least that I know of, to have that kind of grief counseling. We did not and from my recollection, we lost a student. I think we did lose one student when I was in high school. I think that was because of a car accident. Obviously, somebody we didn't know, but it was not something. When I say somebody we didn't know, it was someone who was not in my circle. And so we acknowledged that it was a terrible thing. But beyond that, we did not need that kind of intense mental health counseling.
Well, it is a common practice, especially since COVID, that a major investment has been placed to be able to support our students. As a matter of fact, we have a program called telehealth that goes beyond the walls of our schools. And our Hazel Health telehealth program allows for students to not only get support at school, but for free of charge, they can call up and receive mental health support at home or after school hours as well. So again, we have the support in school where we can kind of put an impact team at that school for a week and have supports there in the gymnasium, have conversations with small groups of students, individual students. And then on top of that, students can get additional support through Hazel Health, our mental health service. So this is something that unfortunately is very common throughout school districts across the country. I think COVID taught us that our students unfortunately struggled quite a bit post-COVID with mental health. So these supports are in place and will continue to be in place.
I did want to ask you a question that I'm going to be asking the health director also. As you are probably aware, the Maryland Department of Health has confirmed a case of measles in Howard County. This is not in the school system, but this is in Howard County. This person had come through Dulles International Airport, had completed some recent international travel, and is now, of course, as I said, in Howard County. You are aware that this measles case in Maryland is not connected to the cases in West Texas or those two deaths. But with all of that said, are you also concerned about the ticking up of measles cases in this country and how this may possibly, in fact, impact the state and indeed Prince George's County?
I think, Harold, what this boils down to, because what we learned over the course of several years, is that there's an available vaccine for the measles. For so many years, we didn't see outbreaks across the country. But I think what's different now is that we have a number of families that feel differently about vaccines. And when you have less community members being vaccinated, with something like the measles, then unfortunately we have situations like we've seen across the country with an increased uptick in the measles. So again, vaccinations the measles it's a choice, and so parents have that choice. It's not something that we require as a school district. There are certain vaccinations that school districts require, and there are certain vaccinations that are really up to the discretion of a parent. But
no, go ahead, finish, please.
But I would, me personally, I have two children myself, one school age son that's in middle school, and I made the choice early on to have him vaccinated as a baby for the measles. So it is a choice thing, but I think what COVID taught us is that people have voice, people have choice, and unfortunately, we've seen less individuals vaccinated by choice.
Mm-hmm. I did want to ask also, you said that on Wednesday, those robocalls are going to be going out. Let me ask you, why wait until Wednesday? Why not?
No, not. I think I may have miscommunicated that.
Okay.
The actual vaccination event is on Wednesday.
I see.
So we've been communicating with the health, like I said, the health department, who's been great to inform people that will have opportunities to be vaccinated at certain places. So yeah, we've, social media, all kinds of different opportunities to inform parents, robocalls have been going out in preparation for Wednesday's event.
I see. Thank you for clearing that up. Wanted to make sure. We are joined now by Dr. Matt Levy, the director of the Prince George's County Health Department. Dr. Levy, thank you so much for joining this important conversation.
Thank you for having me.
Sure thing. I'm going to be asking you some of the same questions that I've already asked the superintendent, but certainly your medical expertise may provide some different kinds of insight. Do you have any information about the third death of an elementary school student as to whether or not that is related to the flu yet, or is the investigation still ongoing?
We don't. The medical exam. We're waiting for the medical examiner's report. So we don't have any additional data whether that's related or not.
Mm-hmm. Can you give us an update on what you have learned over the past 3 days after the superintendent shared this information on Friday with the public? What can you tell us?
Specifically about what?
Cases, whether or not there's been any change in information since this information was first released on Friday. For example, I know that at James Madison Middle School there were 72 cases. Are you hearing about any more cases, or what can you tell us from your office?
So what I can tell you is that we're in a pretty significant flu season, and the cases across the county and across the state are up. I mean, the good news is I think it seems like we've peaked, and we're starting to come down. In February, I think it was February 8th, the hospitalization level was 11.1. Now it's 4.95. So we're starting to see a peak in this, and the coming down of it. Now, the flu this year has been much more of a factor than COVID or RSV was over this year. And it's been pretty significant.
About that, because when I was speaking to the superintendent about this earlier, usually when the public starts hearing about flu season, flu season is a late summer, early fall kind of public information thing. The flu vaccines become available in the early fall, et cetera, et cetera. People get their flu vaccines. And then usually around this time, historically, and I know that's kind of been the case since I've been covering this for the past 40 years or so, we don't hear a lot about the flu as spring starts. Is this unusual?
I would say this is not necessarily unusual. I think there's a if you look at it may be a little later, but it's in general it's still within the normal frame of reference for flu. This season goes from September to April. It's a general. It can even go a little further than that. So it's that's where the peak is, and it's a wide peak. It's not a very dramatic peak every year. It's a little different each year, and that depends on a lot of factors, right? It depends on what's happening. It depends on when it comes here. It depends on how much socialization we have. It was pretty non-existent during the pandemic because nobody was with each other, right? So that kind of just stopped the whole flu season. So it depends on a lot of those factors, and also the virulence of the illness.
I asked the superintendent about this on Friday when we first got wind of this information. At what point would you make a decision to close a school?
Well, we really would work closely with the school system to see. One of the factors is, are there enough teachers to teach the students, right? If there
Mm.
aren't enough teachers to teach students, then you can't operate a school. But we really work very closely with the school system to make that determination. And part of it's based on that factor, as well as what the number is of the children, um, and how rapid it's increasing.
Mhm. What do you want parents to know about the flu, the vaccine? And I ask that with the caveat that there are still a number of people out there who think that the flu is a bad cold.
We've had a flu vaccine for many years. It tends to have one of the lower rates of vaccination, and it changes every year. So you have to get it updated every year. And the vaccine rates have been going down over the course of the last 6 or 7 years, um, because um, because when we were in the pandemic, everybody was getting vaccinated. There was no flu, but as we've come through it, people, I think, in some ways were a little fatigued. But the viruses don't get fatigued, right? The viruses continue to evolve every year. So we recommend that people do that. And the sad incidents of these two children highlights the danger of flu, to should highlight the danger of flu to families, that this is not just a common cold. It goes into the lungs. It causes respiratory distress sometimes. There are vulnerable populations, but it can cover the gamut of age. So we recommend that all children get vaccinated with the flu vaccine every year,
Mhm.
as adults and the elderly as well.
I also asked the superintendent about this. As you are aware, the Maryland Department of Health has confirmed a case of measles in Howard County, not in the school system, and that
Mhm.
this person had participated in international travel. And again, not related to the the West Texas cases or those two deaths there. But even knowing that measles is not only a concern, but also the data suggests that it is a real thing. What what is your strategy and what is your message for possibly addressing that in the county, even outside of the school system?
So we start with messaging. We work with our other partners to identify any cases that might occur. The truth is, if we have a 95% immunization rate, then it reduces the risk dramatically, and that you create that what's called herd immunity, which I'm sure everybody's familiar with that now. Um, and it protects us. So if you have enough people surrounding the person who gets infected, they cannot spread it to each other. That's sort of the idea behind herd immunity. If you have only a few people that are vaccinated, then it can make its way through a crowd into the next crowd and into the next crowd. So we, we have to work with each other. We have to take care of each other, and in order to do that, we need to be immunized against measles. We had a case, I believe, last year as well, from an international traveler. It didn't go anywhere. Um, this time we have this case. We do contract tracing to try to find out where the people that were exposed were, and to see where they fall on the immunization schedule.
Mhm. Dr. Levy, outside of immunizations, can you kind of give us some one, two, three ABCs of for parents to address the flu or the risk of it at home?
So it's a lot of the similar things we talked about during COVID, in the sense that we recommend masking. We highly recommend it at the schools. It's not a mandate. I want to make sure that's clear. We're recommending it to the schools, especially with high levels. Although all the schools could have masking, and the mask needs to be worn over the face, the whole face, it doesn't need to be a chin guard. It needs to be over the nose, over the mouth, snugly worn. That's the first thing. Great hand washing, 20 seconds, soap and water, or the non-soap sanitizer. And cleaning of surfaces in schools, and I know they're doing that, and the schools are doing very deep cleaning of surfaces on a regular basis. We're not going to do much social distancing in the schools. It's pretty hard to do that. But trying to keep the kids together with the same kids can help as well, so that you reduce the amount of children that are exposed to each other. That may cut down a little bit, but those are the biggest things that we do recommend for parents. Oh, and if your child is sick, keep them home. Do not send them to school, especially if they have a fever. That's generally you're likely to expose the other children to whatever that child has. Even if it isn't flu, it's something. If your child is ill, keep them home for a few days, let them recover, and then they can go back to school.
Mm-hmm. Dr. Levy, one other thing, correct me if I'm wrong. If your child has the flu right now, that means no vaccination for them. But after recovering, should they be vaccinated this late in the season?
There's several different strains. So if they have A, the vaccine also covers B. So it's not a bad idea for them to get the vaccine anyway. It just covers the other strains that they might be exposed to. But they do have some immunity from that for that season, for that strain. And then next year they got to get it again. And we've seen both A and B causing pretty bad problems. So I think it would be worth it for people to do that as well.
Superintendent House, I'll let you have a final thought as we kind of wrap this conversation up.
So, for me, again, I wanted to, those families in the two schools that are reeling from a death, just know that our hearts go out to those school communities, those families. And we want to be a vessel of the experts. Dr. Levy is an expert. He and I have had the opportunity to sit down. We came in similar times, and we take the advice. You notice the things that he shared were exactly what I shared, because I essentially got them from the health department, and we've been working in close partnership. So we'll continue to be a vessel to communicate, to be in partnership with the health department to provide opportunities to be educated and to be vaccinated for this community.
I want to thank both of you, Prince George's County Public School Superintendent Millard House II and Prince George's County Health Department Director, Dr. Matt Levy. I appreciate your time in helping us to stay on top of this and to inform the public. Please keep us posted, and we certainly will be in touch.
Thank you for the opportunity to talk to you.
Thank you.
Take care, Joe.
That is the Daily Drum for this Monday, March 10th. I'm Harold Fisher. Good night.